Dr. O here from RevitalizeMaui. Look and feel your very best. So today we're going to be looking at a very popular procedure that we offer now called the PDO Thread lift. Now, while the concept of lifting sagging areas of the face is not new, the PDO lift is a fresh take on older approaches to non-invasive suspension of the face, resulting in a more youthful appearance. Okay, so one of the great things about this procedure is a huge amount of variability. We can pretty much draw out the lifting vectors, which is what we're doing right here, and then apply the lift in the areas that were marked onto the procedure. Okay, and today we're going to be focusing on one of the most common and popular locations that we see, and that's the lower third of the face, specifically the jowl and marionette zone areas. Okay, so now that we're all marked and we know where our vectors are, we're going to get started with localizing. Now, the cannulas for the threads, they are blunt, so they do need a trocar or needle to enter the skin. And before we do that, we typically will inject a small amount of numbing anesthetic solution into the skin so there's not too much discomfort. Okay, and you can see we've got our trocar here as well as some of the threads. Insert the trocar into the skin. I don't feel this at all. And what we're doing here is just developing the plane for this cannula. And there's that first larger thread which is going in. Once we get it to the right depth, I then insert it into the subdermal plane and start advancing the cannula. You'll see it kind of going smoothly. It's just under the skin in this area called the subdermal space. And we just advance it on. There's not too much discomfort here, actually. Some of that area has local anesthetic in it. Sometimes towards the distal part here, right by the marionette zone, is a little ligament there that sometimes it needs to get popped through. It might be a small amount of discomfort, but not too bad. We'll see. She looks like she's doing just fine. We're past that point now. You can see that the tip of the cannula is starting to rest right there in the marionette zone. And I'm going to deploy it right there. We're going to go with this one. And we'll take it. Take that cannula out and you'll see the thread remains. It's right there. I'm going to apply a little bit of traction on there just to test the lift. You can see it looks really nice. Okay.
Wow. That's just after one? That's really cool.
Okay, now here's the second one. This one's a slightly smaller thread we're using. I'm going to go through the same hole, so no need to apply any more anesthetic solution or injections. And this vector, as you recall, is a slightly more horizontal one. This one we're going to be, it's going to come out a little bit superior to the corner of the mouth. This one's going to be retracting some of those nasolabial folds back. Again, we're putting this in that subdermal space layer. I'm going to deploy that thread right there. And voila, we're done. That's it. Quick note, this patient did have a lip refresh, but there are the before and afters, the frontal view, and the most important, 45 degree. Once again, this is Dr. O, RevitalizeMaui. If you have any questions, go ahead and click the button below or give us a ring in our office, 808-419-7445. Thank you.